My trash bag, I know y'all were taught to put them sometimes at the end of the bed and in all kinds of weird places, other than where I put it. I put mine right here at the hip, and I usually ask my patient to hold on to that for me. And the reason I do that is because I can clean and drop and never have to go over my sterile field with a used betadine swab. Always open your tray on your bed, away from you, side to side. That's how it should be folded. And then closest to you. Remember this top drape, the shiny side is not sterile, so who cares? I can touch that all I want. I usually grab it like this, and so that end stays sterile. And I put my hands closest to her, because I can touch her, and then I leave that down. So now I've got a nice long sterile field. I don't use this. So make a pile right here. There's no rule that says I have to put this in that bag. None. So if I don't want to put it in that bag, I don't have to. I can create a little pile right here. So then my gloves would be right here, but they're not. So we're going to get a new pair. As long as you don't turn your back on your sterile field, it's fine. It can be to your side, just as long as you can kind of keep your eye on it so that I know that, you know, my patient's foot, she ain't moving and wiggling. And if she is, I can say, you know, you need to be really still. Oh my Lord, these are huge. I tried a pair of 7s the other day, which is what I normally wear, but they were awful. And these are 8s, and they're going to be too big. Remember to keep your thumb up when you put your left glove on, because I'm crazy. So now I'm ready to go. Use both hands. Keep them busy, because if you don't, if you just let this one kind of roam around, it will. And before you know it, it's touched the side rail, it's touched her leg. So if you keep them busy right in front of you, then you know for sure that they're always like they're supposed to be. I set mine up so that my cleaning stuff is closest to my patient, and my bag and my Foley are farthest away. And I get all of everything in this tray fixed first. So I open my betadine, put it on top of there. Again, I don't have to put this here if I don't want to. I can simply lay it right here. Open my KY, squirt it in my tray, and now test my balloon, because there's only 3 things I need to do in here. Get my betadine ready, get my KY ready, and get my balloon ready. So there, you know, there usually is a little lid on that. So then I open up my catheter, and I open my catheter, and you know, it's always hooked on this little thing right here. So if you break that hook and then grab your catheter here, you can wrap it around your hand so it doesn't flop around. And then just lay it down, and then grab your syringe. Put it on, test your balloon, and then lube it up, and then put it right back in your box. That will hold it still and keep it from flopping out and getting in trouble. So now, do a second glance. Make sure, am I ready? I've got my catheter ready, my balloon's ready, my everything that I need on my cleaning places ready. So left hand is going to go in and open labia so that I can expose the urethra and see it, and then I'm going to clean. Remember, you do outside, outside, and inside. Okay. So now I'm done with that. I don't even care about that anymore. Pick up your catheter, and I do this. You can do however you want, but as long as it doesn't touch her leg, I don't really care. I set my syringe right here, hold it by the end, because you know you can't put in a Foley holding it way out here. You're going to have to hold it up here close. See the urethra and go in. I'm going to go in here because it ain't going to let me. Go in and in and in until you see urine. Okay, so now I see urine. Go a little bit further, about an inch or so. Hold it with your left hand. That's the only time my left hand should touch the catheter is now, because I'm not anticipating going any farther. I'm going to come out, but I'm not going to go in any farther. Then fill up your balloon. Hold the plunger, because if you don't, look what happens. It comes right back out. So you've got to hold this plunger closed. Let go with your left hand and come up here, and I want you to do one direction and one the other, and it'll twist right off. I'll do that again. One direction and one the other, and it'll twist right off. And then you're done. Pull back till you feel resistance, and then you can tape it into place. When do I get a urine sample? From this bag.
Before you drop it.
Before I drop it, I can go ahead and get a urine sample. So if I'm waiting for urine to come down here, you know, I can kind of help it along to get it to my bag. And when it gets down here, then I should have my container. And you know, the lab from R12 sends their own containers. I'll have my container ready to go, and I'll open up my thing, get my specimen, and then close it up. At that point, I can drop it off the side. If I've dropped it off the side, I'm done. I can't do it anymore. At that point, I would have to get it from my catheter. That's what this thing is for. This thing serves two purposes, actually. One, to clip it to the sheet. Again, to give it a little bit of a tug so the patient gets it home. They go, oh yeah, my catheter's home, before it's pulling here. And it also is designed so that if you're trying to get a specimen, you fold your catheter in half and put that on top, and it'll hold it for you. So now urine will collect in here, and you can collect urine from the ports. Some ports require a needle to get the urine out, and some ports are lure locks for a syringe that you just put in and screw and then pull it out. I think most of them today are going to a lure lock because we're trying to get away from needles in every way, shape, and form. Remember, this does not have urine in it, so don't draw fluid out of here thinking you're sending urine to the lab. What was in here? 10 cc's of sterile water. The lab will have a nice laugh at you if you send that.
Another catheter too.
Yes, because when you come back, what will happen if I take this water out and just leave it sitting here?
Balloon.
The first time any little bit of tension happens, because especially on a girl, you're going to come back and it's going to be laying right in the middle of your bed, and then you're going to be not happy with yourself. So, questions on Foley?